Friends, today we are here to talk about HIV, the AIDS, the most dreaded disease that we know. Let's start from the origin, although we are about to talk about the environmental impacts and the impacts of AIDS on environment. But let's speak about the origin of the AIDS first. The origin of AIDS and HIV has puzzled the scientists ever since 1980s. For over 20 years it has been the subject of debate, and people were talking about the promised flight attendant and even the suspected vaccine programs. The first recognized case of AIDS came in 1980. The gay men in New York and California suddenly began to develop rare opportunistic infections and cancers which amounted to be a common syndrome. This common syndrome, it was discovered, was because of a virus, that is human immunodeficiency virus, the AIDS. We know that we can label the word AIDS, acquired immunodeficiency syndrome, only and only when this virus attacks and has been for long inside the body of the patient, and it attacks the lymphocytes, that is the immune system, and causes the opportunistic infections to come which are not treated by common medicines. And usually when the doctors say that this is something intreatable, we want to test it, and after testing they find that it is the HIV, human immunodeficiency virus, which has attacked. Basically this virus, the human immunodeficiency virus, is a lentivirus. This attacks the immune system. The name lentivirus comes from the word slow, that is, it takes a long time inside the patient and then manifests into the symptoms like AIDS. Basically it was found that HIV is a simian immunodeficiency virus that affects the monkeys, and the history goes to 32,000 years back when it was since it is known. How could HIV have crossed the species is again one question that comes to our mind. We know that it takes a long time, and we know that chimpanzees obtained SIV, this simian immunodeficiency virus, from two other species of the primates, and the viral transfer between the animals and humans takes place, and this is known as zoonosis. The question that comes to the mind of everyone, that how could this HIV have crossed the species? We know that the chimpanzees have had this virus from two other primates. It has taken a very long time, and however the viral transmission between the animals and human is known. This is known as zoonosis. Some of the most common theories about the zoonosis that take place or are known are: one is the hunter's theory, the chimpanzees being killed and eaten and their blood getting into the cuts and wounds of the hunter. This is one theory. The oral polio vaccine has always been blamed, that whenever this oral polio vaccine, because it is made through the animals and then it comes into the human beings, it may have iatrogenically, that is through the medical science, it must have been transferred to the human beings. The contaminated needle theory is well known, that the drug addicts usually share the syringes and the needles and the transmission occurs. But it has also been noted that in Africa in 1950s, when disposable syringes were not that in vogue, but however when they started it was very convenient, and with this convenience, looking to the burdens or the financial burdens over the country, maybe that the same syringe must have been used over several patients, and the dissemination of the diseases must have occurred, because the doctors usually were not that much aware that HIV can spread with that flare. The colonialism theory, the heart of darkness theory, is also proposed. That it is proposed that in 2000, this was proposed by 2000 by Jim Moore, an American specialist in the primates behavior. The conspiracy theory is also in vogue, where it is said that this is a matter of warfare, where certain viruses are left into the air or into the human beings or into the animals, so as to demolish the economy of certain country or something like that. And also when the smallpox vaccine was being inoculated in bulk to say whole of the world, that may also be one of the causes of transmission of HIV, is something that is apprehended. Exactly where the transfer of HIV to humans took place and where the epidemic officially first developed had always been controversial. However, the scientists remain keen to find the true origin of HIV. The AIDS epidemic in Haiti was there in early 1980s, and medical journals and books began to claim that AIDS had come from Haiti. Now there is one again question, what caused the epidemic to spread so suddenly? There are a number of factors that may have contributed to the sudden spread of HIV, most of which occurred in latter half of 20th century. One is the blood industry, the blood transfusions. We know that when the requirement of blood is more, usually the blood banks take the stake. They usually do not screen the blood, and it was not being screened before 1980s, and in that condition also it may have spread through the blood transfusions. Then the drug use. We know that the people who are drug addicts, because heroin was in vogue for a very long period, and we know that heroin addicts, they take the drug by the syringes and they share the needles and syringes unknowingly, and this would also have been one of the factors. We find that all the causative theories have a few generalized facts. The environment that the populations inhabit from time to time affect the individual habits. The macro environment of the population affects the micro environment of the individual, and thus the individual may get into such problems. We understand that the migration of the populations may be due to warfare, may be due to famines, droughts, floods, other natural calamities may cause such a spread of the infections. Migratory habits of the inhabitants may be in search of food, may be in search of employment or other things, that also affects. Sex deprivation due to certain conditions which may be caused in several countries, and the poverty. Then the sugar daddy relationship cannot be ruled out. However, it cannot be taken elaborately at this place. The factors that fuel the spread of HIV usually are low literacy levels, gender disparity, unprotected commercial sex and casual sex with multiple or non-regular partners, certain traditional beliefs and practices, poverty and migration, stigma leading to poor communication and marginalization of the infected persons. Now we shall talk about the disease burden, the challenges and the strategies to be followed regarding the AIDS or HIV. An estimated 33 million people worldwide were living with HIV in 2010, of whom 67% were in sub-Saharan Africa. The region also accounts for 75% of the global AIDS deaths. Sub-Saharan Africa is only region in the world where women are disproportionately affected by the HIV epidemic in comparison with men, with the proportion hovering around 60% over the last 5 years and nearly 90% of all the children living with HIV AIDS. Looking to the Indian scene, the first case was encountered in 1986 in Chennai, 5.2 million infections estimated by the end of 2005. Maximum transmission was through heterosexual contact, that is 85%. Male female ratio is 3:1, that is 3 males per 1 female are affected. Heterogeneous epidemic was there, that is it was affecting the general population of variety of origin. HIV-1 subtype C is most prevalent, and National Prevention, Treatment and Control Program is being instituted since 1992. Regarding the stigma and discrimination, inadequate knowledge, poor understanding of HIV transmission, lack of awareness of the universal precautions, lack of knowledge of ARV treatment, that is antiretroviral treatment, opportunities and availability, then failure of the social responsibility, irresponsible media sensationalization, inadequate prevention counseling, failure to inform those needing them about free testing and treatment programs, lapse of the authority, failure to inform and enforce the laws to protect human rights, etc. are there. The key challenges that the human being is facing at this moment because of the HIV, it is scaling up of the key HIV prevention intervention, particularly HIV testing and counseling, increasing access to affordable treatment and care, prevention of mother to child transmission, identifying innovative approaches, strengthening of weak healthcare delivery system, sustainable financing for key priority interventions. The strategies that may be defined to control the epidemic whenever it comes or it occurs in a part of the world, that is awareness about the transmission, modes and prevention, promotion and practice of safe sexual behavior, screening of the blood and blood products first and then institution into the body, using sterilized syringes, reducing infection from mother to child, political commitment, care and support for the infected and affected persons, then reducing the stigma and reducing the discrimination. The steps that are required to be taken are to provide the normative guidance and general tools to the member states. It is the technical support to the member states that is highly required, support countries in access to managing additional resources, for strengthening procurement and supply, the strengthening of the surveillance, monitoring and evaluation systems, and strengthening of the capacity, that is the capacity building of the employees. This is highly required. Then we have to enable the people through capacity building, maximizing the health sector's contribution to HIV prevention, accelerating the scale up of HIV AIDS treatment and care, increasing the contribution of AIDS program in health system, strengthening the resource mobilization and partnership, investing in strategic information system. We have the National AIDS Control Program NACP, which is working very smoothly. This constitutes prevention, care and surveillance. We have high risk populations, we have low risk populations, and we have different strategies to follow there. We have to institute for the low cost and care support, and evidence based planning is to be done. Now, we will talk about the prevention of the HIV. For the prevention through the sexual contact, one should seek the treatment for all sexually transmitted diseases. If somebody has it, even the minimal of the problem, one should seek medical advice for the same. Seek treatment for genital tract inflammation. Use condoms for every risky sexual encounter. Avoid multiple sexual partners and risky partners. Practice safe non-penetrative sex. Avoid combining sex with alcohol and drugs, and such other steps. The vertical transmission, that is from mother to child, can be prevented through providing standard clinical evaluation including clinical HIV disease state, evaluation the degree of immunodeficiency in the mother, documenting the history of prior or current antiretroviral treatment use, then discuss the known or unknown risks with the lady, educate the mother regarding available free care, and refer the nearest center, the AIDS center, so that this mother is safe properly. The testing is to be done. The pre-test counseling is required before testing, so that the prevention is very easy. Whenever a person thinks that the person may be infected about HIV, the pre-test counseling is required. After the pre-test counseling, the HIV testing is done. There are 3 tests in 3 different modes, and a post-test counseling is also required, and a follow-up counseling is then given when it is known that it is a positive case. The blood-borne transmission can also be prevented through the blood and blood products. Mandatory screening of the donated blood should be done. Rational use single unit transfusion system must be used, and the model blood banks should be there, which should give this sort of a facility. To promote voluntary blood donation and discourage professional blood donation. Through prevention of the parent to child transmission, rates of the mother to child transmission, we know that it is 16 to 25% transmission in North America, 33 to 40% transmission in India. The physician should consider the counseling and testing for HIV. By the symptoms, whenever there are sexually transmitted infections, when the individual with the symptoms of opportunistic infections like tuberculosis or certain other infection comes to the doctor, the general practitioner should think that the testing is required to be done. The individuals with persistent weight loss despite good nutrition and negative TB scores, this person is mandatorily required to be tested. The laboratory diagnosis is made. In the newborn below 18 months, the laboratory diagnosis is made. Virological based tests only can detect the HIV infection, we know it. The detection of free antigen, the detection of the viral nucleic acids, the isolation of the virus, which is rarely done, but these are the ways through which the laboratory diagnosis is done. If the result comes to be negative after testing, counseling is required. In this, the review meaning of the result is explained to the person. Currently, there are no antibodies to HIV in the client's bloodstream does not mean that the patient is definitely not HIV positive. Review possibility of being in the window period. Window period is 90 days from the first date of infection. If the client has been exposed to HIV in past 6 months, it is possible that they are infected, but simply haven't begun to produce antibodies against HIV and thus the test is negative. So, a retest may be required. This is to be explained to the person. The post-test counseling, when the result comes positive in favor of HIV, we have to explain the meaning of positive antibody test, the range of possibilities for means of infection and distinction between HIV and AIDS. We have to explain that you got HIV, but it is not AIDS. It may get converted into AIDS whenever you are immunodeficient. So, prevent immunodeficiency and prolong life. That is the motto of the life. Then we have to encourage hope, empowerment and optimism. We have to connect the patient immediately to the source of care and make plan for follow up to ensure that they have been attended. Explain safe behaviors and how to protect self and others. Offer to provide help in disclosing status to the family, the partner, etc. Now, we shall talk about the concomitant illnesses, the word opportunistic infections that we were talking about till yet, that whenever a patient is infected with HIV, that is the human immunodeficiency viruses, this person becomes immune compromised in the time to come, in the years to come rather, and then this person again may develop certain other infections which are very usual, but cannot be treated by routine medicines or routine doctors. So, the HIV related infections and illnesses that are most frequently encountered in India are the bacterial infections like tuberculosis, the respiratory infections, the enteric infections, the mycobacteriosis, atypical mycobacteriosis and certain other infections. The viral ones are herpes simplex virus, oral leukoplakia, varicella zoster, cytomegalovirus, human herpes virus, human papillomavirus. The fungal infections like candidiasis are very common, penicillosis, aspergillosis, pneumocystosis, they are also there, cryptosporidosis, microsporiodosis, they are also common, and other illnesses which come in AIDS is AIDS dementia, invasive cervical cancer and non-Hodgkin's and Kaposis sarcoma. The prevention of serious infections requires certain general measures. These are to educate the patient, to prevent exposure to the ill persons, washing of the hands, avoiding contact with the raw food, soil, cat, bird excreta, litter boxes, washing of the vegetables, boiled drinking water, avoiding ingestion of raw meat, using condoms. Vaccination as feasible for hepatitis, meningitis and certain other diseases can be given. Chemoprophylaxis that can be given through certain medicines. These medicines are instituted so that the disease does not come to the patient. Then again we have to prevent the parent to child transmission, and all the pregnant women should be counseled and tested for HIV as early as possible. In the pregnancy, they must be sent for the counseling. If they are being treated by a private doctor, they must visit an HIV AIDS center, that is the PTCT that we call it. And the pregnant women with no antenatal care who come in labor, that is they come for the delivery directly, should be tested on arrival to the labor ward. But naturally we know that in India testing is not that allowed. A consent from the patient after proper counseling is to be taken, and after the consent the patient can be tested for HIV, and after testing naturally we can prevent the parent to child transmission. HIV and families, if we consider, family needs must be addressed when a patient tests positive for HIV. Initial assessment of a patient's needs with careful attention to the family setting, social support and potential barriers to care is important. These we shall discuss in the environmental factors also. Does the patient need help to disclose to the spouse or other family members? Is there any concern of violence? Are there other family members that should be tested, and will the patient require help of the NGOs, certain other positive networks in order to access care of the HIV treatment? This all is required to be assessed. Couple counseling should also be done. Important elements of the couple counseling are: explain the mechanism of HIV transmission, point out that prolonged latency phase of HIV infection makes it hard to pinpoint exactly when one became infected. To counsel regarding window period, if one is negative, that there exists a window period of 90 days and the patient is required to be retested, assure them the treatment is available which can allow them to remain healthy and productive. The occupational exposure to HIV should also be addressed, that the person should not panic, should not reflexively place pricked finger into the mouth, do not squeeze the blood from the wound, and do not use bleach, alcohol, betadine or iodine, which may be caustic and can cause trauma. What the patient should do is remove the gloves if appropriate. This is usually pertaining to the medical people. Even otherwise, those who wear the gloves in the industries and get injured, these people are also in the same class. They should wash the site thoroughly with running water, better soap and water, irrigate with water, saline, and use soap if it is a skin wound. Otherwise, the eyes etc., they may be washed with saline. Now, we shall talk about the cure that has been achieved in the history of medicine and the environmental aspects of HIV. In 2011, a big boon has come to the world through the stem cell inoculation, that we have confirmed the first patient cured of HIV. This is Timothy Ray Brown. He is HIV negative since last 4 years. Timothy Ray Brown, now living in Bay Area, tested positive for HIV back in 1995, but now has entered the scientific journals as the first man in the world history to have his HIV completely eliminated from his body. It's what doctors are calling it as a functional cure, because 100% cure is yet to be ascertained. The Berlin patient, as Brown is known, received stem cells from a donor who was immune to HIV. Brown says being the first man to be cured of HIV makes him very, very happy. Brown is now being monitored by doctors at San Francisco General Hospital. Now, we shall discuss the impacts of HIV and AIDS on social environment. The social environment is disrupted when the person is infected with HIV. There is dissolution of the households, decrease in school attendance as the children leading households no longer attend the school, destruction of the communities, social cohesion, stigmatism and isolation of people living with HIV/AIDS, abandonment and abuse of women infected with HIV, increase in number of street children, abuse and sex workers of the orphans, overburdening of the public social support system, decrease in human development index, poor morale and stress. The impact on the economic environment is also evident. Decrease in monthly income per capita, loss of economically active people, loss of institutional memory of an organization, inhibition of private sector growth, loss of investment is due to unstable workforces, increased cost of training and replacement, loss of productivity, decrease in GDP of the country. The biophysical environment is also affected. Here, we witness a change in demand for natural resources as the population changes, inability to utilize natural resources efficiently and effectively as labor resources are lost, air, land and groundwater pollution from healthcare waste disposal is there, overall impediment to the sustainable development progress, increased vulnerability of the people living with HIV/AIDS to changes in the environment. The causal factors in the transmission of HIV and the development of AIDS. The determinants description is as follows: environment, the cultural attitudes and practices, poverty, civil war, political instability. Due to urbanization, the low status of women, poor health services and limited coverage, lack of political will, national denial, this all occurs. At the individual level, the impacts are migration, mobility, poor self-esteem, sexual violence, sexual powerlessness, little access to information, poor access to optimal STD care, STD is sexually transmitted diseases, HIV/AIDS myths, IV drugs and other substance abuse. We know that the sexual behavior also determines many things. The sexual networks, the number of partners, the partner change and concurrent partners, prostitution, survival sex, sugar daddies as they are usually called. Then the immediate determinants of such other vulnerable things are that the biologically vulnerable young girls, STD prevalence, low condom use, male circumcision, stage of infection, virus subtypes, unsafe blood supply, sharing of the needles are again a few more causes. Sunita Mukherjee, the country representative of the United Nations Food Populations Fund UNFPA, identifies women in the category vulnerable to climate change, which could reduce income from farming and fishing in a depleted environment, possibly driving women into sex work, thereby increasing the risk of HIV infection. In other words, we can say that the success of the climate change initiatives is intertwined with the sustained reduction of HIV infection rates. With respect to the climate change, however, the opportunities to create synergies are greater in some sectors such as agriculture and forestry, buildings and urban infrastructure, but are limited in other like coastal system, energy and health. Lorenzoni et al. Have noted it is not enough for people to know about climate change in order to be engaged. They also need to care about it, be motivated and able to take action. One of the most significant barriers to behavior change is the perception that mitigation strategies will require drastic changes in individual lifestyle and will require considerable personal effort. Let us bring about a paradigm shift in this perception altogether and make a move towards mitigation with confidence, so that we may allay this big thing like AIDS or HIV from the society. Thank you.